Providers here in Maine are pursuing an alternative model for treating their patients. Direct primary care allows patients to pay a monthly fee directly to their doctor for services instead of billing their insurance company.
Now, doctors say the option gives them more time to spend with their patients, which leads to better health outcomes. Here's News 13's Vivian Lee.
Dr. Jennifer Beal loves being at the bedside, but she was close to burning out for good.
I had about 1,600 patients when I left, and they wanted to double the panel sizes, and I thought, I'm already drinking through a fire hose.
She was also overwhelmed by a mountain of paperwork, leaving her little time to spend with her patients. Less than a year ago, she left a large medical practice in the greater Portland area and started Casco Bay Direct Primary Care with another PCP, Dr. Lean Higgins. Both physicians now see about 200 patients each and spend 30 minutes to an hour or longer during office visits. They're also available to call, text, and video chat on their personal cell phones and make house calls.
They just want time in the office with their physician, or they want to know if they have a problem, they can call you and that you'll call them back, or they can text you.
It's all part of the direct primary care model. Patients typically pay a monthly fee that covers office visits, clinical and laboratory services, and consulting services. Without insurance companies acting as a go-between, providers say patients often get wholesale pricing on medications and blood tests. Fees can run anywhere from $50 to $125 a month.
Come on.
Kevin Brucey says having access to his primary care doctor gives him and his wife peace of mind. Recently, on a weekend, he had what he thought was an urgent medical problem, but he didn't have to go to urgent care after consulting with his doctor.
It gave me the proper guidance. It saved me from the worry and the stress of what do I have to do. It also saved me the expense of going to an emergency room.
Kevin's direct primary care doctor fee is part of his monthly premium with Taro Health. Mainers who enroll with the insurance carrier have access to traditional primary care providers and the option to choose from nearly 40 direct primary care doctors. The company entered the state's marketplace in Cumberland County 2 years ago and has since expanded its coverage to York, Lincoln, and Saginaw counties. Jeff Wan, Taro's co-founder, tells me there is evidence that the model is helping make healthcare in Maine more affordable.
We are actually seeing in the data, in the claims, that there's less inpatient hospital admissions, there's less urgent care visits than what a typical insurer goes through.
Dr. Beal and Dr. Higgins, who are part of the Taro Health Network, believe that not following the status quo is driving an increase in patients and is keeping doctors.
People who are ready to give up are saying, I'm not going to give up, and retire early.
At the bedside, helping patients stay healthy. In Scarborough, Vivian Lee, News Center, Maine.
Now, direct primary care doesn't include specific needs like hospitalization and more advanced testing. Most patients still need a separate insurance plan to get those covered.